Saree, Illinois chapter. With me to moderate the session, we have Shree Gurusamy, the president of Red Saree, Illinois chapter. So we both will be the moderators for today's session. For those of you who are new, I would like to inform that Red Saree is a non-profit organization. Its mission is to promote healthier and happier lifestyle for South Asians. Through this community-oriented education session, especially during COVID-19, our goal is to inform and support the South Asian community to maintain healthy life through healthy eating, engaging in moderate exercise, adhering to healthy habits, and do activities to stay healthy, both emotionally and physically. Today's presentation will focus on lifestyle interventions that will keep you healthy, which aligns very well with Red Saree's mission. So therefore, before I begin, I would like to update you on some details. These are basically our housekeeping details.
Today's housekeeping details, lines are going to be muted. You're welcome to submit questions at any time on the chat window. The webinar will run approximately for 60 minutes.
Yeah, you will get 30 minutes, yeah.
And we will address the questions at the end of the presentation. The webinar is being recorded, and the recording for today's discussion will be available on the Red Saree Facebook page and YouTube channel. And we don't have any break scheduled, but you can feel free to excuse yourself. That's
Thank you, Shree.
Sure.
So now it's my pleasure to introduce Dr. Swapna Dave to present her talk on SAHELI, the South Asian Healthy Lifestyle Intervention. So to give brief synopsis of who Dr. Swapna Dave is, she's the primary care physician from India with a master's in public health from Chicago. Dr. Dave has been working at Northwestern University, the Finberg School of Medicine for the last 10 years. And she manages multiple federally funded clinical trials, and one being SAHELI. And Dr. Dave is about public health and addressing disparities, especially in the minority communities. And in addition to these responsibilities, Dr. Dave performs the commissioner's duty with the Skokie Board of Health for over the last 5 years, and volunteers in the Committee for Prevention of Vaping in the schools in Skokie. And in addition to it, Dr. Dave volunteers for American Charitable Foundation, and also trains medical students who provide care for South Asians. And Dr. Dave's personal and professional interests, she is a Hindustani classical musician and enjoys using her karaoke system. So with all those notes, now I invite Dr. Swapna Dave to present her topic. So we all welcome you, Dr. Dave.
Thank you so much, Annie and Shree, for inviting me to this forum. And I will start with sharing my screen. So this is such a perfect and timely topic, when people are in their homes during COVID. And my goal for the talk today would be to tell you something about our research study, but also give you some tips on some healthy lifestyle and how can you maintain these lifestyles, just within the confines of your home. There's a lot of things we can do to take care of our health just from staying at home. Just to give you a brief background of South Asians, I think most people here in this group probably know who South Asians are, but I'll give a brief introduction. South Asians are individuals from countries. Here on my slide, you'll see from India, Pakistan, Nepal, Bangladesh, Sri Lanka, And there are about 5.4 million South Asians in the U.S. They're one of the largest growing ethnic groups in America. But I don't know if people are aware, they also are at greater risk of death from heart attack compared to any other racial ethnic group. And they are also more likely to develop diabetes. There's most South Asians know at least a couple other people who have diabetes or high blood pressure in their family or friends. So it's a very common condition, chronic disease that South Asians suffer from. But there's also very little research on South Asian health and how do we prevent heart disease for South Asians. I will, towards the end of the presentation, give you a brief synopsis of some of the research studies we do, especially the SAHELI trial. But just want to also reiterate here that, research is really important. And everything, all the guidelines that are created for health, for prevention, understanding heart disease, comes through research. And I will discuss that towards the end of the presentation. So just to give you a brief outline of what we do at Northwestern University in collaboration with other places are some of our research studies. I will briefly describe this. I know there's a lot of verbiage here, but one of our research studies is the MASALA study. I am not sure how many people may have heard about this, but MASALA stands for Mediators of Atherosclerosis in South Asians Living in America. It's one of the first long-term study of South Asians in the world, pretty much. We have sites at University of California in San Francisco and Northwestern University in Chicago. And our goal has been to understand the prevalence of heart disease, like what happens in South Asians. We are following a group of our participants, about 1,000 participants for the last 10 years. And we have understood and have a lot of publications on understanding heart disease in South Asians. And what we saw, I'll present on the next slide, is, South Asians had high rates of diabetes, and second highest rates of high blood pressure, and which is why we are addressing that through one of our other research studies, which is the SAHELI, South Asian Healthy Lifestyle Initiative. It's our first lifestyle program where we are actually teaching our basic community, what are things you can eat from our own culture, our own diet, and how can we make some of those changes to prevent this or reduce the risk factors. So here, this is a table here, which I will quickly kind of walk you through this table. This is from one of our MASALA studies that I just described. When we compared our participants, which were in this data, you'll see about 800 South Asian individuals from the Bay Area and Chicagoland area. When we compared their risk factors for, some of these, diabetes, high blood pressure, smoking, their body mass index, which is a measure of their weight for their height, and then physical activity, which is exercise. When we compare South Asians to some of these other groups here, you see here, the Caucasians, African Americans, Latino, and Chinese, what you see is South Asians had the highest rate of diabetes compared to any of the other racial ethnic groups. So what we saw was South Asians had a very high rate of diabetes, 21% you see, and then high blood pressure, second highest rates of blood pressure, 43%, just second highest to African Americans. And if you also see that South Asians are developing a lot of these chronic diseases like diabetes, high blood pressure at a relatively normal body mass index, which means a relatively normal weight. If you see the body mass, the BMI that you see here is 26, which is not as high as some of the other groups you see here. And you'll also see that the physical activity, which means the exercise minutes, which is the last row here, is the lowest. So I guess if people, can just reflect on this, are people surprised that South Asians do not exercise much? Just when we, you can enter in chat window, is it a surprising finding for us? And what our goal is, again, to change this. We teach people, we found some of these risk factors, how can we change these? And this is how we come to SAHELI. So I'm going to present some of the data on healthy South Asian diet for you. And I will show you some yummy pictures here. So does this food look familiar to you? The yummy dosa, our thali. So this South Asian food, as we know, is very diverse. We have different diets from North India, South India, West India, East India. And what we did was, when in our masala study, we found that South Asian, our participants reported a certain kind of diet, and we were able to follow them and see what kind of diets led to what risk factors. So I'm going to present that data to you next. There are 3 types of patterns that we found in the study, and I'm going to talk to you pretty soon about how can we then achieve the ideal diet or the best diet. So here you'll see the first image I saw here is, there's a Western diet. So out of all the 1,000 participants in our study, we saw that 1/3 of our participants were eating more of a Western diet, more meat, more Western foods, as you see, as an example, pizza. 1/3 of our participants were eating more of a traditional, like more, vegetarian, more fried foods, more of the fried snacks diet. And 1/3 of our participants were eating what we call a prudent diet, which was high in whole grains and more of fruits and vegetables. So this was the pattern we saw. And, the best part of masala studies, we were able to now look at these people with different dietary patterns and how does it correlate to their health. So that's my next slide. What we saw was, on the top slide, people who were eating more of a Western diet, they had more, they had a higher body mass index, which means they tend to be more of overweight. Their waist circumference, which is this, the measurement of your waist, where the bad fat kind of deposits, they had higher waist circumference, and they also had higher of the bad cholesterol, the total, and then LDL is considered the bad cholesterol. So if you're eating more of the Western diet, it wasn't good for you. On the second portion, you'll see here more of a traditional, but more not so traditional in the sense, more fried foods, more snacks, more of the desserts. What we saw was they were more likely to develop diabetes, because of their insulin resistance. Their body wasn't, insulin wasn't working as well in them. And their HDL, which is the good cholesterol, which is supposed to be high normally, that protects you from heart disease, tended to be lower if they were eating more of the fried foods and the sweets. But what we saw was people who were actually eating more of a prudent diet, which we considered healthy diet with more fruits and vegetables, had actually a lower prevalence of high blood pressure. And by metabolic syndrome, I mean some of these risk factors that include prediabetes and diabetes. So what we saw was people who were, again, eating some of this prudent diet was helpful. So my goal today is to talk to you about what a prudent diet looks like. And how can we, take small steps and manage and achieve a more healthy, heart-healthy diet. So just to go in next, I will just go over a quick, what are some, if you look up on American Heart Association, there are some definitions they say for a healthy diet. And I just used that information from their website and created this easy to understand, red, green, and orange signs for us to know what should we eat more of and what should we limit. So if you see, there is, you should try and eat what American Heart Association says. A prudent diet is where you try to eat more of fruits and vegetables, at least 4.5 cups a day, and also try to include more of whole grains, fiber-rich whole grains. Half of your grains that you eat should, you should try to include those to be whole grains. And then they also say that you should try to include some nuts, legumes, seeds, and there are some things that they want us to limit. So they want us to limit the sodium, which is the salt. So no more than 2,400 milligrams per day. And also saturated fat, which is a kind of fat which comes from animal protein. And our goal should be reducing them to no more than 5 to 6% of the total calorie intake in a day. So it boils down to no more than 13 grams per day. And this is, I'm not going to cover how to read the nutrition labels today, but if you're familiar with reading nutrition labels, I would recommend using those for understanding how to limit saturated fat in your diet. And something else that I'll cover today is also added sugar. Any sugar that we add on top of what we eat, like the sugar in our tea or some of our juices, should be limited. We shouldn't be consuming more than 100 calories, which is 6 teaspoons of sugar per day, no more than that. And then for men, it's no more than 9 teaspoons per day. So I'm now going to dive into, how can we just talked about the first pointer. We need to include more fruits and vegetables in our diet. I'm going to try and simplify it for you and teach you how, what should you do to increase more fruits and vegetables in your diet. So when I said in about 4.5 cups of fruits and vegetables, that the recommendation, that counts to about 7 servings total of fruits and vegetables per day. A lot of people are confused about what's the serving size. You tell us it's 7 servings. What should a serving look like? So here I'm trying to just simplify it for you. A serving size is, if you just, again, it's an estimate. If you take any cooked vegetable and you put it in one of your handfuls, that's considered 1 serving. So you'll see here, for example, if this is okra, cooked okra, that comes into one of your handful, that's considered cooked. But the same vegetable, when it's uncooked, it's of course double the size, right? So 1 serving for an uncooked vegetable or fruit would be considered food that can fit into 2 of your hands. So 2 handfuls, uncooked is 1 serving, and then 1 handful of the cooked fruit, vegetables mostly. And then just remember, because the green leafy vegetables, like the spinach or the lettuce or the greens, because they're very fluffy and light in weight, the servings for those should be doubled. So 1 serving would be considered 2 handfuls of uncooked spinach or lettuce. So our goal should be to try to include at least 7 of these servings per day. Now, how can we achieve, those 7 servings per day? Try to get at least 3 of those from fruits and 4 of those servings from your vegetables. So for example, if you start your day in the morning with your breakfast, try to include a fruit if you can. And towards the, during lunchtime, if you're eating a cooked vegetable, try to include some salad, at least try small. Try to include small portions of cooked and uncooked vegetables in your daily diet, and do the same for dinner. And then again, for a snack, instead of going for some of the fried snacks, try to grab a fruit that's easily available for you. Now, why do we say more fruits and vegetables? Because research has shown that they're really good for you. We have seen that, fruits and vegetables, both fresh and frozen, they contain a lot of vitamins, minerals, fiber, antioxidants, and research has shown that people who eat more fruits and vegetables can protect themselves from heart disease, chronic diseases like heart disease and cancer. And this is something I showed also in our study, that people who were eating more fruits and vegetables had lesser prevalence of diabetes and high blood pressure. So that was my first topic, is try to include more fruits and vegetables. Pay attention, 7 servings per day. And again, try to, if you start at 1 serving, you're at 1 serving of fruits and vegetables right now, try to start slow. Try to go to 2 servings and then 3, and then slowly try to achieve your goal. I'm going to now move on to the next topic that we discussed, eat more of fiber-rich whole grains. This is a very important topic. We eat our grains, atta, roti, parathas, naan are a part of our diet. And we consume our grains regularly. So I'm going to share some tips with you. How can you try to include some variety in your whole grains and get some, include some fiber-rich whole grains? And how do you identify what's a whole grain? So here's a picture of, what's a grain. So a grain normally has 3 parts. It has the outermost part, which kind of protects the grain, which is called the bran. It has a lot of fiber. The inner part, which has the endosperm, has a lot of starch that comes from the grain. And then there's the germ, which, as you see here, the germ has a lot of nutrients. That's where the vitamins, that's where the sprout comes from. So why should you try, and these are the different components of a whole grain. So when you try to use your grains, it's important to try and use whole grains. And why? Because the outer bran has a lot of antioxidants, vitamins, minerals, fibers, and then the middle part has the starchy part. It has carbohydrates, some protein, and not as much vitamins and minerals. But again, you need all different components in your diet. And then the innermost part, which is the germ, where the sprout comes from, has it's very rich in vitamins, minerals, and healthy fats. So it's really important when you try to include and eat your grain to make sure that it's a whole grain. And why a whole grain? It's because whole grains, again, from research has shown that if you consume whole grains, you have lesser chance of stroke, diabetes, different kinds of cancers. It also helps control your blood pressure, cholesterol, and lowers, again, your chances of developing diabetes. So it's really helpful in a lot of chronic conditions. But how do you identify what's a whole grain when we, buy and cook our regular meals? So this is, I want you to go home with a tip today. Anytime we try to buy our atta, just pay attention to 100% whole wheat. Again, the brand, if you like certain brands, that's okay. But just pay attention to the term 100% whole wheat or 100% whole whatever, grain. Sometimes it's kind of, it's really hard to know if it's something is 100% whole grain. If they just say 100% atta, like for example here, it says 0% maida, 100% atta. You can't be 100% sure that this is a whole grain. So just pay attention to 100% whole wheat or a whole grain sign the next time you shop. And this is one simple way you can try to include more whole grains in your diet. I'm also going to walk you through some other examples of whole grains that, in our Desi food, South Asian food, we have a lot of different varieties of whole grains that we have traditionally used, and I would recommend that you try and incorporate more of these in your diet. There's a lot of different recipes online that you can try with these different amazing whole grains, like quinoa is a type of whole grain, bajra, which is used, in some fasting, it's kind of acceptable fasting food. There's different recipes you could, and really yummy recipes. The oats, here you see some dosas made from oats. And then jowar is another millet that can be used to make some rotis as well. And you could also mix some of these attas, in your daily food, because all of these different kinds of whole grains, a few other examples here I show, like bajra, barley, brown rice, all of these have a lot of nutrients. And some of the, like whatever the nutrients that bajra has, maybe jowar doesn't. So it's good to include a variety of different whole grains in your diet. And we know that if you try to kind of spice things up, add your spices, limit the amount of salt that you add to your food and sugar and oils, in which you cook, you can really come up with really great recipes and include a lot more fiber-rich whole grains in your diet. These are a few examples of refined grains. So when the germ and the bran, the outermost and the innermost germ, which is rich in fiber and minerals, are taken out, is when it's a refined grain. So for example, a white rice, some of the pancake mixes, maida, all-purpose flour, all of these are considered refined grains. Try to limit the use of refined grains because you're not getting a lot of the nutrients from the fiber and any vitamins or minerals. So try to incorporate different combinations. When you go to the store, just look for 100% whole grain sign. And these are some small tips, where you can quickly try and get a variety of whole grains. One more thing that I want you to remember is that, even for everything, there's a serving size, right? For whole grains too, there is a serving size of how much is one serving. And usually when you eat one meal, it's considered that you should have one serving of whole grain, of a grain, and one serving of a grain is considered to be kind of one handful, one fistful, about half a cup. But then again, a simple tip is a fistful, one roti, one slice of whole grain bread. But a tip for you that I'll tell you is that if you try to incorporate more whole grains in your diet, you will actually be more full. So for example, if you eat a maida roti, just one roti versus a whole wheat roti, you'll probably be more full with that whole wheat roti. Half a cup of white rice will not fill you up, but a half a cup of brown rice will fill you up because it has a lot of fiber. So if you try to incorporate some tips are, some people say I do not, it's really hard for me to change to brown rice. That's fine. If you want, try to mix up some white rice with brown rice. Or, it's okay if you cannot make that change, but can you at least try to make your roti a whole grain roti? Try to, when you buy your bread, try to buy a whole 100% whole grain bread. Just try incorporating a few small changes. And I think, like I said earlier, just try to use a variety of whole grains because all different kinds of whole grains have their own nutrients. And a variety is, of course, will also keep it exciting for you. Then it's not the same boring food every day. Now, after whole grains, please keep adding any questions you may have in the chat window. I'm going to move on to the next exciting part, sugars, because we do consume sugars in our daily, and I would like to kind of go over that part of, how do we limit any added sugar? So just keep in mind, I know people say there's fruits and vegetables have sugars as well. Yes, fruits and vegetables have have sugars, but we are talking about limiting anything that you add on top. The fruits, for example, that comes with the sugar also comes with a lot of vitamins and fiber and minerals, which is good for you, versus added sugar is not needed. Our body does not necessarily need any extra sugar for us to function well. Sugar in itself, has no nutritional value. It just adds additional calories to your diet, and which, if you eat more and more of sugar that has no nutrition, will increase your chance of heart disease. One key is, sometimes we don't pay attention to some of the sugar in our drinks. That is a tip I would ask you, and that's what I'm going to share right now. There's a lot of drinks that we consume which you have no idea has so much sugar. So earlier in the slide, I talked about the American Heart Association's recommendations for sugar. I'm going to just show you visually what that looks like. So if you take small containers, 3 containers of the same size, what you can see here is that a daily limit. So you shouldn't be consuming more than this for the entire day. So for a child, it's no more than 4 teaspoons. So 4 of those small teaspoons, no more than that for a child. For a female, it's 6 teaspoons, and for males, it's 9 teaspoons. Again, remember, we don't really need this for nutrition, but if you have to consume these, we have to try and limit the amount of sugar we consume. And if you can visually kind of keep this in mind, I'm just going to show a few pictures next to you to show how much sugar is in certain commonly used consumed drinks that we use. Also keep in mind the sugar that we add to our tea or daily coffee. Just keep in mind, whatever you do, try to limit your added sugar in your drinks and your food. So this is 1 liter Coke. This probably looks familiar to people. So if you are consuming this bottle of Coke, that's the amount of sugar it has. It has way over the daily limit for anyone. If you see it's full bottle full, so it's probably way over 200% of the limit that anyone should be. And this is just 1 bottle of Coke that you consume. I'm just going to show you a few more examples. And Um, the badam drink, if you've seen some of these products that we consume, just a small container, a small can has 4 teaspoons, which is the daily limit for a child. I also want to share with you, again, please do not pay attention to any brands. It's not to say that this brand has more than that. My goal here is to tell you that there's a lot of sugar, hidden sugars in a lot of drinks, and that is something you need to watch out for. So sometimes people think coconut juice is really healthy, right? How can it be bad for you? But just pay attention, look at the nutrition label, and here you'll see coconut juice. There are, just this one can of coconut juice is supposed to be healthy, has, close to a daily limit for a female, like close to 6 teaspoons of sugar. And this is considered a healthy option by a lot of people. This is again, roux afza. This is, if you just use 3 tablespoons of roux afza, that's again, a lot of sugar. It's about 6 teaspoons of sugar as well. Also pay attention to any orange juices. So juices, right? Very popular. We consume our orange juices. There are different kinds of juices that we buy, including mango drink that's popularly consumed in the South Asian community, but also orange juices that are available in the store. This is just a small container of our mango juice that's available, and if you'll see, it has about 9 teaspoons of sugar just in this small bottle of mango juice. So just paying attention, and you reading the nutrition label for how much sugar is in the drinks will help you limit a lot of added sugars that we consume on a daily basis. And that will help you kind of just small contributions, If you like your mango juice and if you think you want to try some, but maybe try to limit it, try to just use half a bottle, right? And then add some water to it and slowly try to cut down on those. Sugar in your tea or coffee. If you're consuming 3 teaspoons in 1 cup of coffee or tea, try to go down to 2 or 2.5, and then slowly make that change. And I'm going to share what a healthy plate should look like. So this was, please pay attention to to the sugar in your diet. That's the goal here. I just want to show you what a healthy plate should look like when we, try to make our plate for breakfast, lunch, dinner, and pay attention. This is not kind of the big thali that we consume. It's a regular plate that we would, use for our meals. And every time we try to, sit down for our lunch, dinner, even breakfast, try to see if your plate can represent these portions. So the goal would be that half of your plate should be fruits and vegetables. And it could be a variety of fruits and vegetables. And within those vegetables, try to include some cooked and some uncooked portions. It's really important to try and incorporate some of the raw vegetables because there's a lot of vitamins that could be lost when we overcook our vegetables. And please pay attention to how we cook the vegetables. In our South Asian diet, cooking vegetables is very normal. Try to use more of the, vegetable oils. Again, an example could be olive oil, canola oil, vegetable oil. So try to include more of the healthy oils versus some of the saturated fats, which could be, adding more ghee or limiting the amount of ghee you use. And limit the amount of salt or trans fats. Trans fats are, like dalda or vanaspati should be something that should be completely limited. So when we cook our vegetables too, just pay attention that there is not much salt or much of the oils, because the oils add a lot of calories as well. So that's your half the plate. Fruits and vegetables, pick what you like, your favorite fruits and vegetables. 1/4 of your plate should be whole grains. and it could be, it should be grains, preferably a whole grain, and try to include a variety of whole grains. Like I said, there's just so many different, even South Asian food that includes different kinds of whole grains that you could include. Here, it talks about different pastas or brown rice. Limit the refined grains, like I mentioned, like white rice or white bread. And 1/4 of your plate should have some protein, a healthy protein. What do I mean by protein? Protein, if you eat meat or fish, try to include fish, some chicken, turkey. If you eat more beef, try to cut down on the red meat and include some of the chicken or turkey. If you're vegetarian, try to include some beans, different kinds of dals and combination of those. Avoid eating some of the bacon, cold cuts, or any of the processed meats because they have a lot of salt in them. But overall, again, paying attention to how you cook your proteins. So just summarizing, whenever you try to consume your meal, half portion fruits and vegetables, 1/4 of healthy whole grains, preferably whole grains, and 1/4 of a healthy protein, and try to consume more water throughout the day, and limit the amount of dairy or milk that you consume. And also, like I mentioned, the drinks that you drink should preferably water, but try to limit the sugary drinks that you consume. So, in my next slide, I'm just going to show you an example of what an example of a South Asian healthy plate. What should that look like? So on the left here, you see a vegetarian South Asian plate. You see half of the plate has vegetables. So there's some okra you see here, and then there's some raw salad here. Fourth, there's one roti, fourth portion, and then I believe that's brown rice. And then there's some chole or some protein here. And then on the right-hand side, you'll see, similar, half the plate fruits and vegetables, and then 1/4 of the grain, which is preferably whole grain, and then a piece of chicken that's grilled. So just want to summarize now, everything. I think I talked about a lot of different things, but the goal is try to incorporate small changes in your daily routine, and that's how we can achieve this. So in the beginning, I talked about consuming, at least 7 servings of fruits and vegetables per day. Try to use a combination of cooked and raw vegetables, about 4 servings of vegetables and 3 servings of fruits, and try to see, limit the amount of salt and fats that you use when you cook your vegetables. And, the grains I talked about, try to substitute as much as possible any of the refined grains with different whole grains in your diet, and just a variety of different whole grains will help you achieve your goal. And sugar, again, sugar has no nutrition. Try to limit the total amount of added sugars in your meals. And simple trick could be just watch your sugar in drinks and sweets. And overall, when you try to make, yes, Annie, I'm on the last slide now.
Oh, okay, go ahead.
And when you make your plate, you should make sure it's half fruits and vegetables, a 1/4 portion of whole grains, and a 1/4 of healthy protein. So the gist of the presentation is we all can do this. Again, it's not to say that one food is better than another. It's, again, your choice that you make throughout your day. Overall, try to focus on a healthy dietary food pattern, and which is mostly, plant-based. Try to include more fruits and vegetables, whole grains, and protein, and limit the amount of fat and salt. And you can still enjoy a healthy South Asian meal, and be there. I mentioned, just want to end my presentation with why research is really important in South Asians. South Asians are extremely underrepresented in research. They are at high risk for heart disease. They have the highest rates of diabetes I just talked about, but they do not have any specific tailored guidelines for South Asians. So I would recommend, you spreading the word to let people know to please participate in research, because that's how we can increase our representation. And just a quick example of how we can do, how research helps is, when you look at your test results, do people, when we have our test results, they say your hemoglobin A1C is above 6, means you have diabetes. Like, where do these guidelines come from? They all come from research. And if South Asians do not participate in research, we cannot have really tailored guidelines for South Asians, which is why it's important. And I just want to end with letting you know about the South Asian Healthy Lifestyle Initiative. It's one of the stuff that I just talked about is information from our research study that we tell our participants and teach them on a day-to-day basis how to make these small changes. And our goal is to work with the community and develop partnerships and create guidelines specifically for the South Asian community. Here's just a quick quote I would like to share from one of our study participants, which is also on our website, which is SAHELIstudy.org. And he talks about how being in the study helped him reduce his risk for heart disease and diabetes. And here's our website. We partner with different organizations, including North Shore Community University Health Systems, Asian Human Services, Metropolitan Asian Family Services, and the Skokie Health Department. And if you would like to reach out to us, please connect with us on our website and our email at sahelistudy@northwestern.edu. Thank you so much for your time, and I hope you're able to take away a small point from here today.
Thank you, Dr. Swapna, for such a wonderful presentation. And, especially the mission of SAHELI, the community interventions for South Asians. Red Saree's mission too, that aligns so well with SAHELI. So wish you good luck, with your mission. And especially the last PowerPoint, where you showed the healthy eating plate, where you described about, what should be eaten, like vegetables, fruits, whole grains, and drinking lots of water, healthy protein. So I think that is one of the takeaway points, from the session, at least for me. And, you may have, other points as takeaway home. So with
Okay, so I think we'll move on to some questions that we have received on the chat window. The first question they're asking is 100% wheat the same as 100% whole grain wheat?
Yeah, that's a great question. Not necessarily. It's hard to know if 100% wheat is 100% whole wheat. So next time you go to buy, just pay attention to 100% whole. The word 100% and whole are really important to pay attention. That's the only way for us to know if it's a whole grain.
Yeah, okay. And the next question, someone asks, how many grams of sugar in 1 teaspoon?
I'm not sure of how many grams in. Sorry, I'm going to stop sharing my screen. I'm not sure about the number of grams in each teaspoon. Mm-hmm. It's about 4 in a teaspoon. So which is, so 4 teaspoons is, I'm not 100% sure of the number of grams in each teaspoon, but the limit should be about 4 teaspoons for a child and 6 teaspoons for a female.
Okay. Another question, a lot of South Asians, consume a lot of rice, and especially the polished rice. So is there any data showing the risk to the heart consuming the rice versus not?
That's another great question. So yes, we do consume a lot of rice, I think, which is why our goal is, when you make your plate, try to, instead of your plate having a lot of rice, like try to limit it to that one portion. And And I know if you like your white rice and it's really hard to make that change, at least if you try to include more fruits and vegetables, the amount of rice is limited. And then try to include like, different varieties, like I talked about the different vegetables, the different types of whole grains, like the bajra, the roti, 100% whole wheat, and that will make you more full. So you don't feel like you have to. So if you kind of pay attention to your plate and how it's made, that will help for sure, because the white rice is just carbohydrates and you're not getting much of this.
Okay. And another question about coconut oil. We are hearing a lot these days that it's good to cook with it. So what is your opinion on coconut oil?
Another great question. So coconut oil, I know there's a lot of it's going on in the media. When we work with a dietitian, what we see is coconut oil is a tropical oil. So coconut and palm oils are tropical oils, and they have more saturated fat. So even if you include coconut oil, just do not overuse it. Like, just pay attention to how much oils that we use. We all need our fats, proteins, everything in our diet, but how the moderation is the key. So if you want to use oil, pay attention to how much you use, and then try to balance it out with other things, like use more for some other recipe, maybe use olive oil or canola oil or any vegetable oil.
Okay. And we have another question here asking, are there different guidelines for different ethnicities?
What do you mean by guidelines? Dietary guidelines?
Dietary guidelines, yeah. Based on ethnicity? Yeah.
I think that's a good question. I mean, overall, what we see is the health plate that we talked about is a guideline. And then what we try to do is within those, culturally tailoring it to the foods. And the reason we are doing this, the SAHELI study, is to create a guideline. So we are hoping to learn from this study and then bring this back to the community from what we learn. So at this point, there's no specific different guidelines. It's again the my plate and what we talked about, and how do we tailor and watch our food and include our culture.
The next question, do South Asians have a genetic predisposition for cholesterol?
So there is the masala study. We are trying to study some of these different genetic predispositions. There is some work that's been done that shows that South Asians may have, they have a different body type, but we do not necessarily yet know if there's a specific kind of cholesterol or predisposition for increased cholesterol. We know that we do have high diabetes, blood pressure, and cholesterol, and we're hoping to learn more from the masala study. So more to come.
And someone just confirmed 4 grams of sugar in 1 teaspoon of sugar. So you were right. Yeah.
Thank you.
Okay. Okay. And another question, again, this comes up a lot. What is the risk of pesticides, residues, especially in fruits and vegetables? We don't know if you're actually consuming those, are planning to eat the fruits and vegetables.
That is, again, another really good question that comes up a lot. So, that is a true concern. Some recommendations that we make to people are, when you're consuming your fruits and vegetables, try to, kind of soak it in some warm, cool water before you consume them. So the additional pesticides, or at least the residues, can be taken care of. Some people, kind of wash your fruits and vegetables very thoroughly. And if you need to peel some, you may want to. But soaking them, like those berries and even the spinach, soaking them in cool water can also help.
Yeah, especially now with the COVID situation, we are all being very cautious and washing, all our groceries.
Right.
Yeah, so that's a good idea. And we have a question here about olive oil. Is that safe for Indian cooking, which is at a high temperature?
That's another question we get a lot. So olive oil has, the heating point of temperature for different oils is different. So they say you shouldn't use olive oil if you're frying food or heating, the oil too much. But ideally is we shouldn't be using any, you shouldn't be ideally frying much, if you're using olive oil, try to use it at a very high temperature.
Right. Okay. I have a question myself about, consuming homemade yogurt. Now you said not to have too much of dairy, but in South Indian or any Indian meal, yogurt is basically, something that we end a meal with. So is yogurt really good, or is that adding more fat to your body?
Again, another great question. Yogurt is a part of our meal. So it's again, what you consume throughout your day, right? So we want to consume, if you see, we want some of the healthy fats in our meal. So if you like your yogurt, if you take your yogurt, feel free to use it, but then try to see how you use different kinds of fats. Like know your quota for the day, from that plate is that much. Now, if you want to use your quota with your yogurt that you like, because yogurt does have calcium that you need, so it's a good idea. But then now if you're eating yogurt with some other really high fat stuff, then maybe you're going over the recommendations. But overall, if you're eating your yogurt and then watching your other, you're eating your fruits and vegetables and your whole grains, you should be fine. Okay. So it's really the big picture, looking at your plate overall.
So if we actually increase the yogurt intake, then we have to cut down on the milk, you're saying? That way we balance it out?
Maybe, right. So balance it out, right, exactly.
Okay. I think a lot of people are appreciating the session because you've shared a lot of good information, especially sharing the the plate that looks like what we should be eating. Again, I think somebody else is also asking about the high risk for cholesterol. Are South Asians who live in different countries outside of Asia, are they at risk for cholesterol? So they're saying comparing South Asian living in Japan versus the US. What is your take on that?
So we have, with the masala study, we are using this data to compare with some other research studies being done in India. And from what we saw from one of those studies is that actually the South Asians in the US had more pre-diabetes, or they were converting to diabetes at a slower rate compared to South Asians in India had more diabetes. So we are still studying about why that could be, because access to preventative care, there's more attention to prevention here in the US versus India. That could be a reason, but we're still kind of analyzing and looking into that as well. And I would recommend, checking out masalastudy.org, our Masala Study website. We update it regularly with the results from the Masala Study, and there's some really great information on there as well. So please feel free to check that out. Check out our Twitter page. We update some information in there.
Is there a plan to do the SAHELI study in California? One of the participants is asking.
So our goal is always to try and look for new partnerships. At this time, no, but if there's a partnership and if anyone thinks that could be fruitful, please connect them to us via SAHELI study. Reach out to us on our website or send us an email. We're always open to thinking about new partnerships and future partnerships.
Okay. And again, about the SAHELI study, it's an ongoing study, right? Okay.
That's
so
correct.
If someone is interested in, taking part in the study, can you tell us how they would do that?
Definitely. So if anyone is interested in even learning more or knows anyone, please check out our website at sahelistudy.org, or feel free to email. Just send us an email at sahelistudy@northwestern.edu, and a team will walk you through the different steps for enrollment. We have certain criteria where you should have at least one risk factor, which means you should have pre-diabetes or diabetes and blood pressure, but we will walk you through all of those, and then we can enroll you into the study, and then there's certain guidelines. So please send us an email.
I guess that's about it. Oh, and is there a time commitment? Like how long they have
Yes.
to be in?
So this study is the total time commitment a year, but again, it's not that you're committed for the entire year, but you come in, you enroll, and if you enroll into the study, you could be randomized into either the study arm, which has where you enroll into the classes, or the other arm where the same information is given to you via mail or via email now. And then if you're in the classes, you'll come to 16 classes, which are now happening via Zoom. And then we will invite you to come in for a 6-month and then a 12-month follow-up visit. So it is a 12-month commitment, but not necessarily a continuous commitment. You come in for 3 times study assessments, where you complete questionnaires and a testing of finger testing for hemoglobin A1C and cholesterol, and you'll receive those results. And also during the COVID time, we have different protocols. We have a no contact or a low contact protocol where, the contact with the study team member is very limited. We take all the precautions.
So there is one more question, Shree, and this is from Vishuraja Gopalan. He's asking, what are the possible side effects of sugar substitutes?
So sure, that's again a great question. The goal would be you should try and limit the sugar substitutes as much as possible. There is enough research that shows that sugar substitutes, I know for people for diabetes, that's the option, but it can cause some inflammation in your body. And our recommendations are that if that's the only substitute and you have to use it, try to limit it as much as possible.
I think that's yeah, that was really good to know, about the healthy diet option, and also you focused on the South Asian diet, so we could actually understand better. So thank you for a wonderful presentation, and I will have Annie give the.
Yeah, thank you, Dr. Swapna, for accepting our invitation and stepping up and doing such a great presentation. And I would like to also thank Dr. Namrata, who is the principal investigator of the SAHELI. So this is one of the wonderful initiatives that you are undertaking for the South Asian community, and which I so well with Red Saree's mission. So we are partners in a way, to promote the mission of South Asians, for them, South Asians, and who are to make, the South Asians healthier. So I would like to thank Dr. Namrata Khantund.
Thank you so much, Annie. It was great being here and connecting with all of you and talking to you. And we look forward to our future collaborations.
Yeah, because we have many takeaway points. While I'm today at home, when I sit in front of my, eating my dinner, I have to think about that healthy eating plates. So I think that is what we need to now focus on to stay healthy. So. Points, but I think that remains in my mind. So possibly you have some striking points from this presentation as well. So with that note, I would like to end the session by thanking the founder of Red Saree, who is Dr. Shaktivel Sadayapan, and Rema Kasturi, who is the president of Red Saree, and Leda Samu, who is the secretary of Red Saree, and also the president, Shree Gurusamy, who is the president of Illinois chapter. So I would like to thank.
I think they're just having some internet issues. So again, on behalf of Red Saree, Illinois chapter, thank you, Dr.
Other
Davi, for
aspects.
this wonderful presentation. We will continue to spread the word about your study, and more people can take advantage and participate. And like you said, we need the data for South Asians, which is completely missing in the areas of heart health. So thank you again, and
Thank
thank
you
you
for
all for
inviting
joining.
me.
Yeah,
Thank
you
you.
all for joining.
Have a good